First, keeping tabs on your health, May is Hepatitis Awareness Month. Joining us today is Dr. Todd Sheer. He's a gastroenterologist and hepatologist from the Austin Diagnostic Clinic. Thank you for being with us this morning.
Thanks for having me.
Let's start with what is hepatitis, because I know there's several different types.
Now, hepatitis is inflammation of the liver. Most hepatitis that we see these days, though, is caused by viruses. And I think the most important one that we have to worry about in the United States is hepatitis C.
Right. The most common would be hepatitis A. Hepatitis C is the more immediate concern.
Yes, hepatitis C can go on to form a chronic infection, whereas everybody usually gets over hepatitis A. So that's why hepatitis C is more of a health problem. And 3.2 million people in the United States are chronically infected with hepatitis C. Most of them don't even know it.
It can lead to liver cancer. What are some of the ways people contract hepatitis C?
Mostly through intravenous needle sharing or intravenous drug use. Rarely these days through blood transfusion. It's almost non-existent now to get it from a blood transfusion since the late 80s. Other ways, although not definitely proven, are through tattoos, body piercing, and less likely, but possibly through sexual contact.
When we're talking about symptoms, what should people look out for?
Well, unfortunately, most people don't have any symptoms who have hepatitis C, so most people don't know they have it until often it's pretty far progressed. Some people may feel fatigued or have skin rashes, but those are obviously very non-specific.
Right. And so once it's detected, how is it treated?
Well, these days we have pretty decent therapy. We have an injectable medication that the patient can self-give at home once a week, and there's 2 pills that they would use. The treatment is long and it has a lot of side effects. It can last as long as 24 weeks or even 48 weeks. But these days it's about 60 to 80% effective depending on the type of hepatitis C you have.
So if we're talking preventative measures, what do you recommend?
Well, basically for preventative measures, don't use intravenous drugs, and there are other ways to prevent it. If you are an intravenous drug user, needle sharing programs. And these days you're not going to really get it from a blood transfusion, so you shouldn't worry about that. And it's more not so much prevention these days, but treating the folks who have it.
Well, we want to thank you for being with us. For more information, you can go to www.adclinic.com. Dr. Todd Sheer, thanks for being with us.
Thanks for having me.
All right.